Hi everyone, my name is Cheryl and today I'm going to be talking to you about tuberculosis. Nearly 1/3 of the world's population is affected by tuberculosis and millions of cases appear annually. So what is tuberculosis? Tuberculosis is a disease that is caused by Mycobacteria tuberculosis, which is a bacteria. And it is spread from person to person when the infected person coughs or sneezes and the other person inhales it. Typical symptoms of active tuberculosis include productive cough, coughing up blood, weight loss, fatigue, malaise, fever, night sweats, dyspnea, reduced exercise capacity, and chronic bronchitis. People with HIV and diabetes are more likely to develop active tuberculosis. For the pathophysiology of tuberculosis, the tuberculosis bacteria enter the lungs, travel to the alveoli, and there it will multiply. Within 2 to 8 weeks, special immune cells called macrophages ingest and surround the tuberculosis bacteria. It forms a barrier shell called a granuloma, and it keeps the bacteria contained and under control. This is latent tuberculosis. If the macrophages cannot control the tuberculosis, the bacteria will continue to multiply rapidly, and this can progress to different parts of the body, such as the lungs, the kidneys, the brains, and the bone. In this case of TB, the person does have active TB and can spread it to other people. Tuberculosis can be in a variety of sites in the human body. These can be pulmonary, extrapulmonary, military, or in the central nervous system. Pulmonary is the most common and it affects the lungs. Extrapulmonary is when it affects other places than the lungs, such as the larynx, lymph nodes, kidneys, bones, and joints. Military is when the bacteria enters the bloodstream and is dispersed throughout the body. And the central nervous system is when TB affects the brain and the spinal cord. There are different treatment options when it comes to tuberculosis. First off, a TB skin test or a TB blood test will help in diagnosis. These, however, will only tell us if the person has been infected with TB and not if the person has active TB. A chest x-ray and a sputum sample are necessary to diagnose a person with active TB. TB can be treated with medications such as isoniazid, rifampin, ethambutol, and pyrazinamide. Some differential diagnoses that can be mistaken for TB are lung cancer, pneumonia, and COVID-19. Some diseases that TB can be mistaken for and can be used as differential diagnosis are lung cancer, pneumonia, and COVID-19. So let's recap. There are 2 types of TB that a person can be affected with. This is latent TB and active TB. In latent TB, the macrophages are able to encapsulate and control the tuberculosis bacteria in our alveoli. In active TB, the bacteria are duplicating rapidly and the macrophages are not able to control it. With active TB, we're able to transfer it from person to person. However, there are a variety of medicines that can be used to treat and manage TB. Thank you guys for listening and have a good day.